is Jenna. I'm the student nurse today. I'm just going to wash my hands and set up my equipment real quick.
Okay.
Washing my hands. I've got an alcohol swab. I'm washing my stethoscope down. I've got my gloves, my stethoscope, my pen light, and my smelling object already. Can you tell me your name?
Danielle.
Why are you here?
On appointment.
Where are you?
Portland.
What time is it?
12:30.
Do you have any pain?
No.
Do you use any assistive devices?
Nope.
This patient does not report using any assistive devices, and she does not report being in any pain. She's alert and oriented ×3. Her level of consciousness is conscious and alert. Her speech is clear and articulate. She's pleasant and cooperative. She's dressed appropriately for the weather, appears to have adequate hygiene, and she can answer and respond to my questions. Okay, I'm going to start by touching you in 3 different spots of your body. You can report where those are. Close your eyes, please.
My left cheek, my right arm, left leg.
Okay, patient's able to identify the 3 areas that I touched her in, indicating that her sensations are intact in the upper, lower extremities, as well as her face. Okay, can you puff out your cheeks, frown, smile, and raise your eyebrows? Patient's able to listen to commands and indicate that her facial nerves are intact, specifically the cranial nerve 7. Okay, can you touch your nose with your finger and then touch your finger to mine, going back to your nose? Okay. Patient's able to follow commands. Also indicates that her coordination is intact. Okay, I'm going to have you take your fingers and touch them to your thumbs. Okay, patient's fine motor skills are intact. Can you take the heel of your foot and rub it up and down your shins? Very good. Patient's gross motor skills are intact. You can stand up, walk to the wall, and walk back to me. Patient's gait is smooth and fluid. Her gross motor skills are intact. Posture is erect. Head is midline and proportionate to the body and centered. Shoulders and hips are aligned. Do you feel any pain while walking?
No.
Patient reports no pain while walking. Okay. Can you bend down and touch your toes? I'm going to palpate your spine. Do you feel any pain with that? Nope. Patient reports no pain upon palpation of the spine. No masses or lesions are noted or lumps. Patient's spine is midline and there's no evidence of curvature. Okay, can you hold your arms out straight and close your eyes, please? Okay. Patient exhibits no signs of swaying, indicating that the patient's balance is intact. She can do so with her eyes closed. Can you stand on one foot, please? Now the other. Patient's balance is intact. Okay, you can take a seat. I'm going to tell you 3 words that I'd like you to remember for the remainder of the assessment. Dog, cat, and mouse. Okay. I'm going to ask you later what those are.
All right.
Okay, I'm just putting my gloves on for infection control before I palpate the patient's scalp. Okay, upon inspection of the patient's face, her facial features are symmetrical. The skin at the eyes, ears, nose, and mouth are all pink. They appear dry with no excessive moisture. Head is midline and erect. No signs of tremors or tics. I'm going to palpate her face. Skin is pink and dry and warm with no excessive moisture. Do you feel any pain with your face?
No.
Patient reports no pain in the face. I'm going to palpate your head. Do you feel any pain?
Nope.
Patient reports no pain upon palpation. Any headaches?
Nope.
Patient reports no headaches. Skin of the scalp is pink, warm, and dry with no excess moisture. No signs of infestations. The hair is evenly distributed. Smooth and shiny in texture. Blonde. No signs of lesions, adhesions, or wounds. Skull is round with no deformities. No evidence of breakage and no evidence of bald spots. Also no signs of infestations. Okay? I'm going to perform a whisper test now. I'm just going to whisper 1 word in each ear if you can repeat them back to me.
Water. Tree.
Okay? Patient can accurately identify the words whispered in her ears, indicating that there are no hearing impairments. Upon inspection on the outside of the ears, ears are pink and equally distributed to the rest of the body. No discoloration, same color as the rest of the body. Do you mind if I palpate?
No.
You feel any pain?
No.
Patient reports no pain upon palpation. No signs of lesions, adhesions, or wounds or swelling of the ears. No evidence of drainage on the outside of the ears bilaterally. Ears are midline and centered on the head. They are fully formed and fully developed. Okay. I'm going to move on to your eyes. Patient's pupils and irises are round. The color is evenly distributed bilaterally in both eyes. The pupils are 5 millimeters in diameter bilaterally. The sclera is smooth, white, and clear bilaterally, no evidence of discoloration or redness. Conjunctiva are clear with no evidence of drainage or exudate bilaterally. The eyes are almond-shaped and symmetrical on the face. Hair of the eyelashes and eyebrows are evenly distributed. and symmetrical and bilateral. The eyelids, there is no signs of drooping. There's no signs of edema or swelling bilaterally on each eye. Okay, and I'm testing the corneas. Corneas are transparent bilaterally. Okay. I'm going to test for light reactivity. Okay. Pupils constrict consensually and are reactive to light bilaterally. I'm going to have you follow my pen light. Okay. Patient is able to follow all 6 fields of gaze with no swaying and no evidence of nystagmus. They move symmetrically in all 6 fields of gaze. So I performed the 6 cardinal fields of gaze test. Patient is also Perla, as she is able to accommodate. So pupils are round, reactive to light, and accommodate. I'm going to perform a peripheral vision test.
Mm-hmm.
Tell me when you see my fingers.
There.
Okay, patient's peripheral vision is intact. Okay, I'm going to move on to the nose. The nose is midline. Do you experience any drainage of the nose?
No.
Any pain of the eyes or the nose?
No.
Patient reports no pain of the eyes or the nose. Do you experience any pain inside your ears?
No.
Patient reports no pain inside the ears. Drainage of the nose?
No.
No? Okay. So the nose is proportionate to the rest of the body as well. Can you close one nostril for me and breathe in? On the other side? Okay. Patient's nares are patent bilaterally. No signs of deviated septums or occlusions. Okay. I'm going to bring an object over. I'm going to have you identify the smell with your eyes closed.
Soap.
Yep. Patient's able to identify the smell, indicating no impairments of smelling. Okay. I'm going to move on to the mouth. The lips are pink and moist with no signs of skin deterioration, lesions, or cracking. Do you have any pain in the mouth?
No.
Patient reports no pain in the mouth. Can you open up and say, Okay. Patient's uvula is midline and moves upward. The tonsils are not inflamed. No signs of infection. No signs of infection in the back of the throat. Oral cavity and mucosa is pink and moist. No signs of cyanosis. Patient exhibits good dentition of the teeth. No signs of bleeding gums. The tongue is midline, symmetrical, pink and moist. Okay. Okay. Can you tell me the 3 words I said earlier?
Dog, cat, and mouse.
Okay. Patient's short-term memory is intact. I'm going to palpate the sinuses now.
Mm-hmm.
Tell me if you feel any pain of the frontal and the maxillary sinuses.
No.
Patient reports no pain upon palpation of the frontal and maxillary sinuses, indicating no signs of infection. There's no tenderness or crepitus noted under the skin, or signs of infection. I'm going to palpate the preauricular, postauricular, submandibular, and cervical lymph nodes. Do you feel any pain with that?
No.
Patient reports no pain upon palpation of the lymph nodes of the head. No sign of tenderness or hardening of the lymph nodes, indicating no signs of infection. They are non-palpable. Okay? I'm going to have you open and close your mouth for me. Okay? Did you feel any pain upon movement of that joint?
No.
Patient reports no movement of the temporomandibular joint. No signs of TMJ or crepitus are present. Okay, so she has full range of motion in the jaw. Alright, I'm going to move down to the throat and the neck. Upon inspection of the neck, skin is evenly distributed to the rest of the body. No signs of lesions, wounds, adhesions, or redness or rashes. Neck muscles are symmetrical, no signs of jugular distension. I'm going to palpate. Can you swallow for me? Did you have any pain swallowing?
No.
Patient reports no pain on swallowing. The thyroid gland is non-palpable. Trachea is midline. Okay. Skin is dry and no excessive moisture, and also warm to the touch and pink. Palpating the carotid arteries. Carotid arteries are equal in strength bilaterally 2+. I'm just going to auscultate them. Okay. Upon auscultation of the carotid arteries, no signs of bruits or whooshing. The rate and rhythm is regular. Okay. I'm going to do some range of motion of the neck. Can you take your chin and touch it to your chest? All the way back, side to side. Okay, can you push against my hand? Do you feel any pain upon movement of that neck joint? Patient reports no pain upon movement of the neck joint. Patient can perform full range of motion of the neck. Strength is 5 out of 5 of the neck. no pain or crepitus is noted as well. Okay, moving down to the chest, the precordium area, there's no signs of rashes, no skin breakdown or wounds or lesions or masses present. Skin is pink, appears dry, with no excess moisture. I'm going to start palpating. The lymph nodes on the chest are non-palpable. Do you feel any pain?
Nope.
Patient reports no pain upon palpation of the lymph nodes of the chest. Do you experience any chest pain ever?
No.
Patient reports no chest pain. Skin's warm and dry, no excess moisture. No signs of lifts, heaves, or thrills. No signs of crepitus on the chest. Okay, just going to listen to the heart sounds. Starting at the second right intercostal space, the apical. Moving to the second left intercostal space, the pulmonic. The third left intercostal space, the Erb's point. Moving to the tricuspid at the fourth, and the mitral at the fifth. Moving over to my bell, going back over the mitral and the tricuspid. Okay? So upon auscultation of the heart sounds, no evidence of murmurs is present. S1 and S2 sounds are heard, and the heart sounds regular are strong. The rate and rhythm are strong. Okay, so moving on. Upon inspection of the patient for the respiratory assessment, she does not appear to be using any accessory muscles. She breathes with ease and breathing is quiet. Her chest cavity is cone-shaped and symmetrical. Do you have any difficulty breathing?
No.
Any pain while breathing?
No.
Patient reports no pain while breathing or difficulty. Okay. So I'm going to listen to the anterior lung sounds. Take a deep breath in for me when you feel my stethoscope. Okay. Upon auscultation of the anterior lung sounds, no adventitious breath sounds are heard, and lungs are clear on auscultation. Vesicular and bronchovesicular sounds are heard. Okay, I'm lifting up the back of the shirt. Upon inspection of the skin of the back, skin appears pink, dry, with no excess moisture, no lesions, rashes, wounds, adhesions, or masses. Do you feel any pain in the back?
No.
Patient reports no pain in the back. Upon palpation of the back, there's no masses or wounds. Skin is warm and dry, no excess moisture. Okay, just going to listen to the posterior lung sounds. Take a deep breath in for me when you feel my stethoscope. Do you lift your arms up for me? Okay. Upon auscultation of the posterior lung sounds, breath sounds are clear on auscultation. The bronchovesicular sounds are heard near the midline, and the vesicular sounds are heard in the periphery. No signs of adventitious breath sounds like rales, rhonchi, wheezes, or crackles anterior or posteriorly. I'm just going to assess for lung expansion. If you can take a deep breath in. Okay, lungs expand symmetrically, as evidenced by my fingers separating by 1 inch. Okay, I'm going to move on to range of motion and strength exercises. Can you push up on my hands? Okay. Can you rotate your shoulders in big circles? Do you feel any pain upon movement of that joint?
No.
Patient reports no pain upon movement of the joint. She can perform full range of motion in the upper extremities of the shoulders. No signs of crepitus. Patient's strength is 5 out of 5 in the shoulders. Okay. Can you bend your elbow for me? Spin your wrist. Okay. And spread your fingers. Okay. And do the same with this hand. Spin your wrist. Spread your fingers. Okay. Can you put your nails together for me? Okay, patient's nails exhibit a diamond shape with a nail angle of less than 160 degrees, indicating no evidence of clubbing. Nails are smooth and non-tender. Capillary refill in both hands is less than 3 seconds. Skin turgor on the left side is brisk recoiling, no evidence of tenting. On the right side, brisk recoiling, no evidence of tenting, indicating adequate hydration status bilaterally. Skin on the arms is pink, warm, and dry with no excess moisture, no signs of lesions, adhesions, or wounds. The radial pulses are equal in strength bilaterally 2+. The hand colors are pink, warm, and dry, equally distributed to the rest of the body. Same with the arms. Okay, I'm going to have you lift up on my arms, push down, grab my hands and squeeze. Okay, patient exhibits full range of motion in the upper extremities and equal in strength bilaterally, 5 out of 5 in all upper extremities. Do you feel any pain in the joints?
No.
Okay, no evidence of pain in any of the joints. Okay, you can lie down for me. Now lift your shirt up. Keep your legs up there for me. Upon inspection of the abdominal cavity, skin appears pink and dry with no excess moisture. Skin color is evenly distributed to the rest of the body. Usual contour and waves. You can abdomen is evident for peristalsis. There's no signs of rashes or adhesions or lesions or wounds. Just going to listen to all 4 quadrants of the bowel for a full minute, including the vascular sounds. Upon auscultation of the bowel sounds, no hyper or hyperactivity is noted. Bowel sounds are present. The left and right iliac, left and right renal, aortic, and the left and right femoral arteries show no evidence of bruits or whooshing. Do you feel any pain, nausea, or vomiting?
No.
Patient reports no pain, nausea, vomiting of the abdomen. Upon palpation, no evidence of masses or hernias or lumps are present. No swelling or edema or ascites. Do you feel any pain upon palpation?
No.
Patient reports no pain upon palpation. Okay. I'm going to do some strength exercises and range of motion of your legs. Can you pull up on my hands, please? Okay. I'm going to flex your leg, extend, abduct, adduct, circumduct. Okay, and this leg, pull up, flexion, extension, adduction, circumduction. Do you feel any pain in the knee joints or the hips?
No.
Patient reports no pain in the knee joints or the hips. Patient can perform full range of motion of the legs. Legs are equal in strength bilaterally, 5 out of 5. Okay, I'm just going to put some gloves on. Okay, can I see your feet? Okay, I'm doing capillary refill in both feet. Capillary refill is less than 3 seconds in both toes. The tenting on both feet is brisk recoil, no evidence of tenting. Turgor indicates adequate hydration status. The dorsalis pedis on both feet is equal in strength bilaterally, 2+. The posterior tibialis pulses on both feet is equal in strength bilaterally, 2+. Okay, can you move your ankles in a circular motion for me? Spread your toes wide. Okay. And this foot, circular motion, spread your toes wide. And then can you push against my hand and then lift up? Push against my hand and lift up. Do you feel any pain in the ankles and the toes?
Nope.
Patient reports no pain in the ankles or the toe joints. Patient exhibits full range of motion of the toes and the feet, and full strength in the feet and of the legs. Skin color of the feet and the legs is pink, warm, and dry with no excess moisture. No evidence of edema or swelling or masses or lesions or wounds. Equal in color to the rest of the body. Okay, thank you so much for coming.
Thank you.
It's a pleasure to meet you.